Hey everyone! So, as a future doctor, treating tuberculosis is a given. But I'm going to tell you right now, the old textbook approach, it's just not cutting it anymore. Today, we're going to break down a real game changer in TB care, the clinico-psychosocial approach, or CPSC for short.
All right, let's just get right to the heart of it. The main idea here is simple, but it's also incredibly profound. A win against TB isn't just about prescribing the right drugs. It's about really seeing and understanding the entire person who has the disease, their thoughts, their fears, their life at home. Let's see how that actually works.
So how do we actually put this idea into practice? Well, that's where the CPSC framework comes in. Think of it as a brand new lens for your clinical toolkit. It helps bring the whole patient into sharp focus, making sure we don't miss the things that really determine whether they'll get well and, just as importantly, stay well.
Let's start with a big question, one that kind of challenges what we first learn. We're all trained to see TB as this infectious disease that mostly goes after the lungs, right? But is that the full picture? I mean, what about the intense fear it causes? Or the lost income from being too sick to work? Or the social isolation? Yeah, the answer is a hard no. It's so much more than that.
And this is the solution. The CPSC approach is a model that weaves together three critical dimensions. You've got the clinical. That's what we see, the signs and symptoms. Then there's a psychological, what the patient is feeling and thinking. And finally, the social, the world they actually live in day to day. When you evaluate all three, you stop just treating a disease and you start caring for a whole person.
So let's start with the C, the clinical part. This is our home turf, right? This is the stuff we know. But in the CPSC model, this is just chapter 1. It's an absolutely essential first step, but it's not the whole story.
The clinical pillar really stands on three core actions: getting a super detailed history, doing a really thorough physical exam, and ordering the right investigations. If you nail these three, you're setting yourself up to correctly identify the disease and anything else that might be going on.
Now, here's where it gets interesting, because you can see how the lines already start to blur between the clinical and the social. Of course, we screen for those 4 classic symptoms: a cough for over 2 weeks, fever, weight loss, night sweats. But we also have to ask about contact history, risk factors like diabetes, and these huge socioeconomic factors like overcrowding. This is where the diagnosis really begins. And when it comes to diagnostics, this is the key takeaway from the latest 2023 NTEP guidelines. The CB0, you know it as the Gene Expert test, is your first-line go-to test. Why? Because it's fast, it detects the TB bacteria, and it tells you if there's resistance to rifampicin, one of our most important drugs. It's the gold standard for getting a quick, accurate diagnosis. Okay, so we've got the clinical picture figured out. Now it's time to widen that lens. This is where we shift gears from just identifying the disease to truly understanding the patient by looking at all the psychosocial stuff going on.
I love this slide because it shows the two mindsets side by side so clearly. The typical clinical focus is on symptoms, x-rays, lab results. But the psychosocial focus looks at the stigma, the family support, their job, their income, and whether they can even get to the clinic in the first place. And here's the bottom line: you cannot successfully treat one side of this chart without understanding the other.
So what are we actually looking for here? Psychologically, we're screening for depression with tools like the PHQ-9 and getting a sense of how they're dealing with stigma. Socially, we need to map out their support system. Who's their caregiver? Can they afford to take time off work? Can they even pay for the bus to come get their meds? These aren't just nice-to-know questions. They are absolutely central to whether a patient will be cured or not.
All right, so we've done our big CPSC assessment. We've gathered all this incredible information. Now what? Now we have to turn that info into a real holistic treatment plan that combines medicine with practical, real-world support.
For drug-susceptible TB, the medical foundation is this 6-month regimen. You start with a 2-month intensive phase with 4 drugs, HRZE, to really hit the bacteria hard and fast. That's followed by a 4-month continuation phase with 3 drugs to make sure every last bug is gone for good.
But listen, those pills are only half the battle. We cannot, and I mean cannot, overstate how important nutrition is. The body is in a fight and it needs fuel to battle the infection and repair all the damage. A patient who is well-fed just responds better to treatment and bounces back faster. It's that simple.
And it needs to be the right kind of fuel. The goal is a diet that's high in calories and high in protein. So as you can see, you want the bulk of their energy coming from good, complex carbs, but also a serious amount of protein, around 1.2 to 1.5 grams per kilogram of body weight to help rebuild all that damaged tissue.
Now check this out.
This is where the social assessment connects directly to a real solution. We know nutrition is a huge barrier for many patients, so the government's Nikshay Poshan Yojana provides 500 rupees per month directly to every TB patient just for their nutritional needs. That is a perfect, tangible example of the CPSC model in action.
Okay, on to the final, crucial phase, making sure this recovery sticks. Starting treatment is one thing, but completing a long 6-month course is a whole different challenge. Let's look at the strategies for adherence and long-term support. Honestly, counseling is probably our most powerful tool here. It all starts by just educating the patient, making sure they know that TB is curable. That alone gives them hope. Then you use techniques like motivational interviewing to help them overcome barriers to taking their meds, connect them with support groups to fight the stigma, and use proven methods like CBT to help them manage the anxiety and depression that are so common on this journey.
And this really brings it all home. The main point is this: we are not just treating a sputum report. We are not just trying to clear up a chest x-ray. Our real job, our true goal, is to help that person get their health back, get their job back, and get their life back. We're trying to restore their entire quality of life.
So as you move on in your careers, I just want to leave you with this question. The healthcare system, it's going to measure you on cure rates. And look, those numbers are important. But the CPSC approach asks you, it challenges you to look so much deeper than that. Because the cure rate, that's just a number. The patient's quality of life, that's the real story. Which one will you focus on?